So I was lucky enough to grab at least grab my phone charger, and I got in the car. You talk about it takes 20 to 30 minutes to get to the hospital. I almost didn't make it.
Wow.
Which is crazy. By the time I got to the ER, I was already gasping for air. So imagine, if I didn't, leave when they told me to, I'd probably maybe be dead.
Hi, how's everyone doing? This is Shelomo Solson, the host of the Teenage Impact Podcast, where we share stories, tips, and strategies on how you as a teenage kid can overcome any struggle in your life. If you haven't done so already, please click the link in the description to download one of my free ebooks called The 7 Quick and Easy Ways to Feel Better About Yourself. This is based off of the 60 plus interviews I have done with people around the world, hours and hours of my own therapy sessions, being mentored by worldwide coaches and mentors on how to feel better about myself, and use this free guide to get yourself out of this funk, because we all know the types of troubles we are going through today. Today's podcast guest is one of my good friends. I've known him for about 10 years now, and he's one of my fraternity brothers back from Tampa, Florida. Just about back in March or April, his name is Jason Ho, and Jason caught the coronavirus. And Jason's one of the most fit people I know. He exercises every day. He's huge. He's always dieting. He's doing pretty well. But then he got the corona. He lost 20 pounds. He was in the hospital for about 2 weeks. And that kind of just changed his mindset about a lot of things. And today I'm going to interview him on, what he went through, how he felt, and how he was able to overcome those challenges. How you doing, brother?
Good, man. Thanks for having me.
Not a problem, man. Let's first start off with, how did that all happen? How did you catch corona?
I work for the United States Coast Guard, and I was on duty. It's very hard, especially, back then I was a pretty early case. It is very hard to trace, where you could have gotten it from. And, back then, people were still trying to figure it out. But it looks like, I probably got it when I was on duty, and, I got really sick, and people say, most people will have it very minor to no symptoms. But, I'm part of the 20% that had it very, very severe.
Mm-hmm. And when was this? Around what time?
About mid-March.
Mid-March. And then walk us through from getting the symptoms. What were your initial symptoms like?
This started on about a Monday. I started feeling a little funny. I thought it might have been allergies, right? Just like everyone else. I didn't feel well, so I said, okay, maybe not a big deal. But I didn't have a thermometer. So by Tuesday, I went to go get the thermometer. I saw I had a fever at about 103. This is Tuesday evening. And I wasn't feeling good. By Wednesday, I started to have body aches. I lost my sense of taste and smell and sense of taste. By Thursday, it was getting a little difficult to breathe. Luckily I have a lot of good friends, fraternity brothers, close friends. They're all in the healthcare profession. My sister is a nurse practitioner, and I had two really good friends of mine, Anthony and Joanne. They work at the hospital that I was at. So they called me and they said, they FaceTimed me, said how I was doing. And based on my condition, this is by Friday morning, my sister and my friends, they said, you should get to the hospital, man. So I said, okay, let me see, because, I'm thinking it's not a big deal. I don't want this a big thing when it doesn't have to be, right? And, but by Friday afternoon, they said, you need to drop your stuff and get to the hospital right now. And so, luckily, I changed my clothes and, I was smart enough to grab my phone.
The hospital called you?
No, my friends.
Your friends, okay.
Yeah. So I was lucky enough to at least grab my phone charger, and I got in the car. You talk about it takes 20 to 30 minutes to get to the hospital. I almost didn't make it.
Wow.
Which is crazy. By the time I got to the ER, I was already gasping for air. So imagine, if I didn't, leave when they told me to, I'd probably maybe be dead. Calling 911 on my floor, at home.
Uh-huh. So you went to the hospital. What's next?
And so let me back up. So Wednesday, I went to the hospital to get tested. But again, this is early March. They didn't have enough test kits. I also wasn't severe enough, so they told me to go home and self quarantine. But yeah, so Friday evening, I went to the ER. They gave me a CT scan and, did some tests on me. They saw I had a pneumonia. I had an infection in my chest. And so they admitted me to the hospital, to the ER.
Mm-hmm. How long were you in the hospital for?
I was in the hospital for 10 days. The first week, it was very difficult. Yeah, I was maxed out on my oxygen. They gave me oxygen through my nostrils,
Okay.
and that still wasn't enough. So they gave me the mask that goes over my mouth and my nose, and that helped a little bit. But even then, it's still very, very difficult to breathe. I couldn't go to the bathroom. I couldn't even get up. So laying in bed for I couldn't even use my feet. I couldn't get up, right? So laying in bed for 2 weeks, they had put things on my legs to keep the blood circulating, because if not, I could end up getting a blood clot, getting a stroke, and having a heart attack.
Mm-hmm.
So I couldn't eat because I couldn't taste anything. I couldn't smell anything. Everything tasted like cardboard. And unfortunately, the hospital had really good food, and I couldn't eat any of it.
Man, I can't even imagine.
My potassium levels were very low, so they had to give me pills for that. Again, I couldn't eat, so they had me on liquid protein. Because I was losing too much weight. They had me on antibiotics. And the hardest thing, besides not being able to breathe, is probably the psychological part, right? Because I'm quarantined, in isolation, 24 hours a day for 2 weeks.
Uh-huh.
The only come in are nurses and doctors, but they're in almost like a full hazmat gear. You can't see their faces. They all look the same, so they come in and people say, luckily at that time, most likely I survived. I think, they can't tell me that, the guarantee that I would live, right? So, imagine, 2 weeks laying in the hospital bed. I can't get up. I can't really move without, gasping for air, wondering if I'm going to sit there and I'm going to die. Also, too, think about no one can see you. My family couldn't see me. Nothing you can do about it,
Mm-hmm.
So,
What else is going through your mind besides like wondering if I'm going to survive or not?
more so, how long I'd be there, because I thought I was gonna be there for a few days, right? Ended up being 2 weeks, but yeah, every day, because I took it, hour by hour, because it's just imagine, like people who have asthma, right? They have asthma attacks, but that lasted all day and all night. You can't breathe. You're literally gasping for air just to adjust in my bed.
Mm-hmm.
Left me get there. Thing is, with the oxygen, it was not enough. And the nurses, unfortunately, that's the best they could do. So luckily there's a few nurses that were really great. Most of them were really good to me, and some of them stayed in the room, at nighttime, just to know that I wasn't alone. Because at the end of the day, the only thing to do is be there for me. My body had to fight it, with the antibiotics.
That's crazy. And then you went back home after 10 days, 2 weeks. What was your next steps to recovery?
So I got discharged on April 1st, April Fools.
I literally no, hear me out. I saw you post that. I'm like, it's on April 1st you posted it. It can either mean you're serious or you're putting an April Fool's joke. So for those who don't know, he put up that he was in the hospital for 10 days on April Fool's Day. I'm like, this guy is putting an April Fool's joke. That's the wrong thing to do. But then he was actually real. So I felt bad.
yeah, it's the worst joke of my life.
Yeah.
And when you're in the hospital, people don't realize, that when you're there for so long, that's why they ask you, when you're there for an extended period of time, they ask you, do you know what year it is, or who the president is? Do you know what day it is? Because you start to get loopy.
Uh-huh.
When I was discharged, I didn't know it was April. Because I was there for so long. All the days looked exactly the same. If I didn't have a window in my room, I wouldn't know if it was day or night. Because you're just laying there. But yeah, I was discharged on April 1st. Went home. I had to self quarantine because I still had the virus, but at least I was able to breathe on my own, and that's why they discharged me.
Uh-huh.
So it's still a little difficult to breathe, but as at least I didn't need the oxygen. So I went home. I self quarantined. I had to stay downstairs because I live in a 2-story townhouse, and I couldn't go up and down my stairs. I had to pretty much lived downstairs for almost a week. Just to go upstairs to my room, left me out of breath. To take a shower or do anything physical, was very difficult. And then on top of that, I started getting anxiety attacks. So I'd be in the shower and I start to have a little bit, it'd be a little hard to breathe. And then that kind of lead to an episode of an anxiety attack and kind of make it, a lot worse.
How did you manage those anxiety attacks?
Just talk myself through it, mentally, right? Talk myself, that I'm out, I survived, right? Which is the best part. And just breathing treatments, and slowly, breathing exercises, I started meditating, and that really helped.
And how does, you've gotten the flu before, we've all gotten the flu. How does catching the corona compared to catching the flu?
So at the beginning, right, the symptoms in the very beginning, the fever, the coughing, is similar, but when it starts to get, when it escalates, it is nowhere near, imagine, the body aches was tough too. Imagine getting hit by a truck. Not that I know what it feels like, but yeah, everything hurts, and you're exhausted. Even when I got home by 8:00 p.m., I was completely exhausted. I had no energy left and I was out. So in the beginning, it will look like the flu. That's what I thought it was. And again, most people will have it very mild to maybe no symptoms. We don't know how, they still don't know how it affects everyone so differently.
Yeah, we don't know, because I do know, well, several people who've gotten the coronavirus, someone who has absolutely no symptoms whatsoever, and people like you who's in better shape than most people, had severe symptoms, so which didn't make any sense. I mean, I'm sure no one really does know why up until this point, but I do know, I don't know anyone who's died from it, but I do have friends who knows people who have died, loved ones, fathers, grandfathers, friends. I think I have probably 8 second-degree connections of people who have passed away from it. So a lot of people are not taking it as serious as they should, and other people are taking it really serious. What do you think is the right balance of how serious people should really take this situation?
So, we live in an age of social media and technology. So, it's very easy to spread misinformation, right? And so, to some extent, I agree, every media outlet has their own spin on things, right? So it is difficult to really believe, 100% what different people are saying, right? And I get that. That doesn't take away from, the severity of, this is still a global pandemic. It still has the potential to kill you or make you very sick. Again, most people, probably won't, have it very severe or very bad, but that doesn't mean that you can get it very severe or very bad and or die, or maybe you might be fine, right? But you might pass it to someone, maybe a grandfather, a parent, an aunt or uncle. And again, not just old people now, right? You talk about young people. So you might pass to someone, like me, that ends up, getting knocked off my feet. And that's probably the one thing that really saved me, is being as strong as fit as I was. So I think it's pretty crazy that it's gotten to a point where that people are trying to make it political. This has nothing to do with politics, right? It doesn't matter whether you're young, you're old, right or left. You're not invincible. And I think for us to live, we live in a culture where we promote individual rights over our social responsibility to our peers, to our community, right, to humanity. So you look at a lot of other countries, they for the most part they have a pretty good grasp on it, because everyone's on the same page. Because they say, oh, I understand that, yeah, I do have a right to not wear a mask, right? But also, I think I have a social responsibility to my community that if I could be a asymptomatic carrier, right, which means I have it, but I don't have symptoms.
Yeah.
That people think that it's not a problem, so they go out and they're unknowingly spreading it to everyone, and then it exponentially spreads from there. Next thing you know, someone gets it that maybe can't fight it and ends up dying. And whose fault is that? Because you're too busy worrying about your individual right. We live in a culture that any minor inconvenience, people lose their minds. We went from 3 to 5 days Amazon shipping to 2 days. Now it's 1 day.
One
Now
day,
it's
yeah.
same hour shipping, which is, crazy. I agree there has to be balance, right? There's no need to panic, right? And all the fear mongering stuff like that. But also we need to understand that if we all got on the same page and understood that, simple things like wearing a mask and, keeping social distancing, if we all just got on the same page with that, this would all be, I wouldn't say over, but we'd be over this a lot quicker, but
Absolutely.
everyone wants, do their own thing. And now because of that, things are shutting down again, and we can't move forward.
Especially in Florida, because I know you live in Miami, and cases there are just skyrocketed.
Yeah.
It's unbelievable. Yeah.
And I hate to laugh, but it's so ridiculous that we come to this point. It's almost laughable if it wasn't reality.
Uh-huh.
That to me, it makes sense, right? To you, it makes sense. But some people, you go out there and I met people who said it was a hoax and to my face. And, I said, this is not my department. I'm not even gonna bother with this, or that think it's not real. But, and you also got to understand too, I think a lot of people, it doesn't directly affect them. Right. So, just like how, they don't know someone personally or hasn't affected them, in their personal circle. So it's something they see on TV or something they hear about statistics, they see numbers, right? But until they get it, someone they know gets it or gets very sick or ends up in the hospital or God forbid, dies, then it becomes very real. And I think, we understand we live in, 6 degrees of separation, right? But I think it's come to a point now that gap is closing, and sooner than later, someone we know, and we come to a point now, people we know, secondary contacts, have gotten it or passed away, so, it's going to become very real. And until that happens, unfortunately, I believe that, a lot of people have to learn the hard way.
We're all affected some way, somehow, whether we like to say it or not, especially if you have a business, if you have a job. I know for you, you weren't just affected with Corona, but you're also affected other ways too. Your professional plans were affected. A lot of people's professional plans in school, summer vacations, everything was affected. How can someone deal with being home and trying to have mental clarity with everything going on, even if they don't catch the Corona?
And yeah, you made a good point, not just, physically and medically, you're talking about, no one is immune to the effects, right? It has a ripple effect. You're talking about, finances and people's, livelihoods or, essentially way of life, and also moving forward, our habits and how we, interact with each other, is going to change, right? There's no, we say there's no really going back to normal, right? This is new normal. Mm-hmm. So, for me, people say, why is it so difficult that people can't stay home, right? People start, going a little crazy. For me, the way I see it, right? Where I live, is, I live in a comfortable place, and my place is clean, so it's just me and my dog. I don't mind staying home. I have everything I need. I had all the food I need. I got my own gym, right? So I don't have to leave my house. And I'm lucky enough and I'm fortunate enough that, at least, I'm still getting paid by my employer. My medical expenses are covered. Also, for long-term care, I don't have to worry about that as far as getting access to health. For people who, maybe aren't as fortunate, because I've been reading articles that's a topic of concern. People are worried that whether they got paid for testing or, if they do catch it, whether it's severe or mild, those medical expenses, I'm sure it's going to be, I don't even want to look at what my medical expenses were. But again, I'm lucky enough, I didn't have to worry about that. And again, like you mentioned, not just, medical wise, you're talking about people's professions, a lot of my friends, had great jobs, and a lot of them are either, laid off or they got notices that they could be laid off, and, you're talking about, mortgages, car payments, stuff like that. So, I'm not an expert, right? But just what worked for me is, really a lot of meditation and, kind of, like you said, get clarity on my own life and moving forward, because it put a hold, on my career, I guess you say plans, but, just a lot of meditation and just, slowing down, and because, I guess we got nothing else to do in a way, it gives us more time to really focus on ourselves, really. I did a lot more, I've been doing a lot more reading and personal development. because prior to this, I kind of put a pause on that, but I've always been big on personal development and really self-development, and kind of figure out, what I want to do, and also too, one of the biggest aspects, for me to move forward, right, is, my doctors can't tell me that, there's going to be ongoing conditions, right? So I have to follow up with my doctors in 2 months and make sure that nothing happens. They can't tell me that in 1 year, 5 years, 10 years, I'm not going to, I joke about this, kind of make myself feel better, but that I'm not drop dead in 10 years, because there's not enough data out there. It's science, right? And they're always discovering new things about the virus, for better or for worse. They can't tell me that, I'm not gonna have, conditions or develop conditions, down the road. And I also, my profession requires me to be physically able-bodied, so imagine if that happens, I might end up, getting retired medically. What am I going to do? These are things you got to think about.
It's difficult. I mean, especially for me, I know I had plans on speaking to schools and having different speaking engagements and going full-time with my business, and that kind of got put on hold with a lot of speaking engagements being canceled just because schools were canceled. And now I have possibilities of having speaking engagements lined up for the fall, but that's all on pause too because they don't know if it's going to be virtual or in person. So, I mean, I know you brought up a good point with the whole personal development. I know that's really worked for me. For people who has their life down south or things are not going out the way that they should, personal development books help. Really meditating has really changed my life. Having morning routines really changed my life. Exercising helps. All the basic things that they tell us to do actually does help.
Imagine that, right?
Yeah, but I mean, do you still get anxiety or PTSD from being in the hospital that long, being in quarantine for about 2 weeks? Just those symptoms, do you relive those things at all?
To be completely honest, I still do.
Uh-huh.
I'm still seeing a specialist, in therapy for the anxiety, for the PTSD.
Uh-huh.
And I guess why I work out so much is that's kind of like my form of therapy, gym therapy. Because I realized a long time ago that when I'm feeling good and I'm feeling healthy and I am healthy, that also that leads to other aspects of your life. So I still deal with that today. You're talking about 4.5, 5 months later. And that's something a lot of people don't talk about, right? I've gotten over the coronavirus, but you're talking about the long-term residual effects, not just physical, but mental. It's hard to focus sometimes. So I got to see someone about that. So
Yeah, my entire podcast is revolved around resiliency. I've interviewed people that's gone through all types of struggles that you could think of. And resiliency is your ability to overcome struggles in life. It's not about what happens to you, it's how you bounce back. But what does resiliency mean to you?
I think kind of like they have a saying, it doesn't matter how many times you get knocked down, but each and every time, and this really knocked me down, right? Knocked me off my feet. But I'm not gonna say, I'd say I'm fortunate enough that I was able to bounce back a lot quicker, right? And I say quick, loosely because it's been 5 months, but it's a process, right? And my doctors told me it is a process, because imagine I lost about over 20 pounds, and for me as a power lifter, and gym and working out is like part of my life. So it's like, man, when I started working out again, I couldn't lift anywhere near where I was before, right? I knew it was a process, and that I had to take it one step at a time, one day at a time. But I kept on going, day in and day out, and lucky for me, I gained all my weight back, minus the fat. But I gained all my weight back. I'm lifting again, 95% what I was before. I had goals to lift even more this year. So I think it's really just being grateful, right? That I was able to survive, right? When some people are not as fortunate or not as fortunate. That's the biggest part for me, being grateful that I have the ability to bounce back, and I still have the ability to keep on going.
Thanks so much, Jason, for doing this interview. Just so my listeners can find you in whatever social media platform, where can they find you?
Facebook, I'm on Facebook. I'm on Instagram, so they can search my fine. and they can connect.
Mm-hmm. Well, I appreciate you for doing this. It really means a lot. I know it's been a while since we caught up, maybe a few months. I can't remember one of the weddings we probably saw each other, but really appreciate it, brother.
Yeah, no, I thank you for having me, and I've been following you too. Keep doing what you're doing. Being a change and impacting people and using a platform to reach out and especially reach out to the younger people and be and all the positivity.
All right, man. Thank you.
All right, thanks. Bye.
Thank you for tuning into the Teenage Impact podcast. There's just one takeaway I want you from this entire podcast, and that's just to wear a mask. Don't just wear a mask for yourself, but wear a mask for your loved ones, because you know what's going to happen. Jason was in incredible shape. He's one of the most fit people I know out of all my friends, and he was still affected. He didn't have any previous medical conditions. He was in the hospital for 2 weeks. And it still affected him months later. His PTSD, he had anxiety. Sometimes he just thinks about still being in the hospital. You want to prevent that as much as possible for yourself and for your loved ones. So wear a mask. Thank you for tuning in to the Teenage Impact podcast. If you haven't done so already, please click on the link in the description to download the 7 quick and easy ways to feel better about yourself. Please follow me on Instagram at Shelomo Solson. Message me to let me know what your favorite podcast episode is. And until next time, peace.